Hello, I'm Dr. Robert LaBelle. Today we're going to be covering what we would do in office to treat hip pain. As a follow-up to the hip theory video, what we're basically going to be doing is initially assessing the patient's flexibility. If you can bend forward, Ariana. What we first look for is the global flexibility of the patient. Can the person's fingers touch the floor? That would be a general measure of the ability to flex. As well, what we want to look at very often is what angle is the hip flexing at? Is she flexing through the low back or is she flexing in the hip? In here she has some hip restriction, and if we palpate through the hip, we can find some tension into there. And that will give us an idea as to where to release. If you come on up, if you lay on your back, please. The treatment of the hip is twofold. Initially, we're going to be stretching the patient as well as showing them a home stretch for their hip pain. We typically do 3 angles in hip stretching. If we pretend there's a clock here and this is 12 o'clock, we would initially stretch the patient at 12 o'clock and then at 1 o'clock and then at 11 o'clock. What this ultimately does is it stretches all the angles in the hip, giving a full 3-dimensional release to the hip. If you lay on your right side. In releasing the hip, it's pretty straightforward. In a reasonably painless activity, what we're going to do is work through the hip tendons as Ariana moves her leg back and forth. What this does is it releases the adhesions in the hip, giving greater flexibility to all the tendons. We very often will work through all tendons in the hip. So let's go through and show an example of that. I'll end up holding a tight tensioned muscle spot. If you bring your knee up to your chest as far as you possibly can and straighten it out. Done in a slow, controlled manner, what ends up happening is the tension in the hip muscles and tendons tends to break down, and you facilitate regrowth of new tissue, new flexible, pain-free tissue in the area, thus causing the patient's hip pain or bursitis to dissipate over time. Typically would do this for about 5 minutes, and we would work through the entire hip. After doing that, what we would end up doing is retesting the flexibility of the patient. So if you can stand up, Ariana. And bend forward, please. What we're looking for here is an increase in gross range. Can she reach the ground further, and as well, is her hip rotating better? And would typically ask the patient, does that feel more flexible? Are you able to move a bit better?